it came about for you knowing what iTeracare is? Could you answer that question, Franz?
Yeah, as I remember, Wally told me that uh, one of his friends, I think that's you, Doc, send him
Yeah.
a message or like a link of something that he shared to me that
Uh-huh.
says it's a device or something that can help someone to heal or to help with their health problems. But as I see it, and as a nurse, um, it's so hard to believe, and it's so,
Yeah, that's true.
yeah, it's so doubtful. Um, yeah, I did not give any attention on it because, you know, that time I'm busy doing my thing. Like I have a work as a nurse, and even though I have a lot of health problems, I don't give attention on this. I don't have any interest, as I say. Yeah, so I don't pay attention on that, and I don't believe until the time that one of our children diagnosed with cancer last year. And so I'm so desperate. We are frustrated and everything. And I think of how can I help my child that's suffering, who is suffering right now. And so one time I also asked my husband Wally to contact you, Doc. And so the first time that we used that to her, that's before her surgery. It's really on time. It's on the right time, like before the surgery. And so we did the therapy. The time, because our child is, we thought she's healthy. She did not have any signs of symptoms yet. She doesn't have. And so when she had her surgery, um, uh, she has a breast cancer, Doc Bunny. So when she has a surgery, we know that me as a nurse, I know that she will suffer like numbness of the limb of the affected side, and she will feel tinglingness or tingling sensation of the of the parts of uh, the side of the surgery, and also pain when she will lift the arm. But because of using that therapy, in just few days she can raise her hand.
Wow, that's amazing.
Lisa, that's amazed me so much. The healing process of the surgery, it's so fast. It's
Wow.
amazed us. The tingling sensation of the fingers, she felt it, but it did not long. The numbness and the pain did not long. It's like really in maybe a week there still have there, but after that she can really raise her hand as full range. And
Wow. That's
that's
amazing.
amazes, that's amazed me as a nurse, because I know what she will experience. We are we both nurses, but you know, yeah, I really amazed with that. One thing is that when she started her chemotherapy, there's no vomiting at all. She did not even have a loss of appetite. She even gained weight.
Wow.
Yeah, and her doctor said, um, it seems like you're not really have your chemotherapy. It's like, she's like, you're gaining weight. And
Wow, that's amazing. What about her sleep?
about her sleep, Doc Bunny, before she has her diagnosis, she's suffering anxiety, and
Mm-hmm.
for that, she has most of the time, not just sometimes, she has um sleepless nights. It's
Mm-hmm.
hard for her to sleep if the anxiety attack, um she cannot sleep, so she has insomnia, and so much more when she was diagnosed.
Correct.
But when she started using the iTeracare, the device, um, of course, if you are a patient of cancer, if you are cancer patient, you will be frustrated,
Mm-hmm.
be depressed. But the difference of using the device and before, it's a big difference.
Mm-hmm.
She used the device, she said she can sleep as much as she can. Yeah, and it's a deep sleep.
Wow.
My
Yes.
daughter now, she is when she just finished fifth cycle, and Doc Bunny, um, her oncologist tell her that she will experience severe pain.
Uh-huh.
Because on the fifth to eighth cycle, uh, the oncologist changed the um, the chemo medication. It's much stronger,
Stronger. Uh-huh.
and he gave her bone medication,
Uh-huh.
and he said to my daughter that she will feel pain.
Mm-hmm.
But my daughter told me that her pain is very mild, very moderate, bearable now. Yeah.
Wow. Thank you for sharing with me your daughter's
Yeah.
experience. But going back to you and Wally,
Mhm.
what did you feel about, because you guys, when you came back to Canada, you bought the machine and it's the
Yeah,
premium.
yeah,
And
I bought a machine.
could you tell us about what happened to you both while
Uh,
using that machine?
Actually, after hearing those amazing things that had happened to my daughter and my wife after using the therapy device, I said to my wife, "Why not buying the the device?
Uh-huh.
I wanted to use so." And then because I have a sleep
Sleep apnea.
apnea problem,
Mm-hmm.
that's why
He is using CPAP,
CPAP,
Doc
yeah.
Bunny,
That's
CPAP.
right. Yeah.
And my wife told me, and even you, Bunny, suggested to use iTeracare device
Uh-huh.
every day, hoping that my sleep apnea
Uh-huh.
will be cured or
Resolved and
It
gone.
would be, yeah, it would help. It would help to resolve it, and
Yeah,
maybe it would
we are
eventually move out of your system.
hoping. We
Yeah,
are hoping
working
for
on it.
that.
my
Yeah,
wife told me I sleep better now.
better now. That's good.
He doesn't notice it, Doc Bunny, but I always telling him, you know what? Um, when the first time you use the device, you have a
Yeah.
deep sleep.
Yeah.
That's what I recognize, and what I notice is that every time, Doc Bunny, I'm evening shift, and I always arrive at home at around past 12 midnight, and
Mhm.
I just open the
I
door,
wake up. I
he
woke
wakes
up.
up. But
Uh,
that time he told me that, what time did you come? What time did you come? He told me, and I even sitting with him, beside him on the bed using the iTeracare, and the blow is so loud,
wow. Uh-huh.
and he did not even hear it.
You're on
Yeah,
God. you're actually dreaming on the other side because your fall asleep is so deep. It's
Yeah,
Yeah,
he's
right.
always
yeah,
that's one thing that I noticed from him. He always have a deep sleep, and
that's
I I always ask him, "How do you feel when you wakes up?" He said, "It's like like fresh
Yeah.
or
that's right.
it's
Yes, and I can remember that I had dreams. Before it's just like
yeah."
I
He's
just
telling me
sleeping and
that
that no dreams.
Oh, that's good.
for some time he said, "I I cannot remember when was the last time that I had a dream," but
Now,
now he said, I remember that I had a dream, but I cannot remember my dream. But I know that I had a dream.
wow,
Laughing.
that sounds like a song.
My daughter has a great experience, a good experience about this. I also have mine. Before going back to the Philippines, to take care of to be with my daughter, I'm experiencing lower back pain,
Hmm.
and I'm experiencing frozen shoulders and stiff neck.
Uh-huh.
If you remember, Con, um, when if I'm going to stand up or get out from the bed, if he's there, I will ask him, "Come, can you please pull me up?"
Yeah,
Because it's so hard for me to
understand.
get from bed because of my lower back pain and my stiff neck. If you call me from my side or from my back, I will do like this.
Yeah,
And
robotic.
yeah, robotic. You're right. Um, and me doing my work as a nurse, it's so hard for me. When I'm there, since I give the device to my daughter as a gift, of course I have to try it.
Uh-huh.
So I try it, and the first time that I use it, I was so amazed. And just first therapy, although it did not gone that all my pain, it helps me a lot. I even before I'm just this, maybe this is the fullest, but when I do the therapy, I do like this,
Wow.
but there's still pain that time. But now, Doc Bunny, I am zero pain, totally zero pain.
Wow.
I cannot even remember now the pain that I'm experiencing before.
How about the stiff neck and the back pain?
Yeah, no more. Yeah.
Wow, that's amazing. That's
Yeah.
really amazing.
Yeah, this is really amazing. That's why I told you I am a believer right now, and I'm so happy without the pain because I'm suffering for that more than a year or 2 years, the back pain. But my frozen shoulder, maybe 6 months, 7 months.
Wow. Yeah.
Hard. So
My last question to you both is for those who are listening right now and for those who are watching us, what could you tell those people who doesn't believe what we're doing and what we experience? And for those who are in the sideline, who are still thinking, am I going to go try this or not? What would you say to them?
for me, I don't blame you
Oh, that's true.
for not for being have a
Skeptic.
doubt,
Hmm.
not believing of what we are saying, or it's like too good to be true.
That's right.
But I would suggest that please try, especially if you have pains or suffering any illness. Just try, and just try to use the device. If you have someone introduced to you, tell them to, can I try this first? Yeah, just try. There's no harm in trying this. It might help you. Yeah, it really might help you. And I'm so glad we also have it and tried it, and we're using it right now. Yeah, that's what I can say. And yeah, I really don't blame them.
Yeah, that's true. It's true.
Please try.
That's true. Well, thank you so much for your time and I really do appreciate it, and from the bottom of my heart, thank you so much for uh, letting us do this and to share it to the world. Again, a reminder is that for a disclaimer, I always say this, that all of our experience is our own personal intake. It's all of our personal feeling and what we felt and what we experienced. We're not saying this is going to be good for you or what, but you try it. You try it.